Some with loved ones in nursing homes say they're left in the dark about what's going on inside. For months, the Department of Health was releasing a weekly report showing cases in those long-term care facilities as well as deaths. But that's not happening anymore. The data now released by the state doesn't include anything about long-term care centers. 10 Investigates' Jennifer Titus has learned some facilities have actually gone back on lockdown, and a majority of staff members are still not vaccinated.
She has only been in there since October.
94-year-old Mary Blackburn has been in a nursing home for almost a year.
When she went in, we were able to visit her. Not a lot, but we had 2 scheduled visits per week.
Lyn Deckman says that's not the case now. The facility is back on lockdown after positive COVID cases among staff and residents, including her mother, who is vaccinated.
So it was weird for her to test positive.
A CDC report leaked overnight regarding COVID-19 mentioned the COVID vaccine seemed to be less effective in nursing home patients than once thought.
Maybe a good idea now to start thinking about another shot in the population that's over a certain age group.
Dr. Jill Roberts says the effectiveness data isn't shocking. It's an older population. She says we still have to do whatever we can to prevent the virus from entering long-term cares.
Given the CDC data that shows that some of these people who are patients here may have lower efficacy and are therefore at risk, we need to make sure that people that are working with them are vaccinated, right?
But the latest report 10 Investigates obtained from the Center for Medicare and Medicaid Services that includes that data doesn't look so good. Out of the entire 10 counties that make up the Bay Area, only 6 facilities are reporting 75% or more of their staff being fully vaccinated.
Yeah, and that's really sad, to be honest. I mean, these are the individuals that we would like to be out in the community actually doing the good work and saying about how beneficial that the vaccines are, and that they're not getting vaccinated is concerning.
It's concerning to Lyn.
I don't understand it because to me, the science is there. Just if you're going to work in a population that is at risk, then either get the vaccination or take some months off.
Lyn says she hopes that the state will also start to release data regarding cases in long-term care centers again. 10 Investigates did reach out to the governor's office and the Agency for Healthcare Administration regarding that data and whether or not they're rethinking putting any more protocols in place. But we still haven't heard back.